Hello, everybody. Welcome back. This is Dr. Elsie Coe from Lead Physician, an online program for physician leadership. Today, I have Clarissa Barnes. Dr. Barnes is from South Dakota, and she's got an amazing story to tell you. She is the medical director at the Light program at Avera Health System, where she's in charge of the strategic direction and implementation for the clinical wellness program for over 1,200 providers in 5 different states. She's also a physician advisor to clinical documentation and utilization review. She's a hospitalist, and she's current president of the board of directors for South Dakota and the wellness champion for the American College of Physicians in South Dakota. How are you, Clarissa? Good to see you.
Oh, thank you. I'm so excited to be here.
Oh, thank you. We have a great story to tell, right, Clarissa?
I hope so. I like it.
So tell us how you got all these leadership positions. How did you, let's just start from that. How did you get into leadership? Is that something you've always wanted? And did you have any coaching?
So for me, I think leadership is sort of a state of mind. You know, I believe in leadership from the front, where it doesn't really matter what your title is, that you have the ability to influence the team of people you work with, the work that you do, and to make that better. And that makes you a leader, whether or not you're technically the head or you're, someone else just working in the trenches. So for me, I think leadership is sort of inherent, I hope, in everything that I do.
Right.
In terms of actual administrative positions, that's something that's come more recently, probably over the last 5 years or so, sort of an increasing administrative time as I've tried to keep making things better, not just for, small groups of us, but sort of hopefully larger and larger groups as we try and make healthcare work better for everyone.
Yeah, that's awesome. So obviously you had some innate desire to get into leadership. It wasn't just like you found it by luck.
No, I think that's always been sort of my plan. I think it's hard because, I've always wanted to, but at the same time, you want to be not just well-meaning, like, hey, I want to make things better, but you also want to be well-informed. So a lot of my early career really was learning how to be a doctor, right? Like learning how to practice medicine. How do I, document this? How do I build this? How do I build those longitudinal relationships? And you have to do all that groundwork before I think you can be really an effective leader in a position of administrative authority.
Somehow you found the desire to, or the passion to change systems. I mean, you said that verbatim to me, and I that struck me because not that many physicians I've spoken to, and I've spoken to a lot of physicians who have told me that outright that they want to change systems. Can you tell us how that came about?
Yeah, it's funny. I've lost the attribution at this point, but like my favorite quote about physicians and physician leadership is that every physician has 2 jobs. The first is to practice medicine and, make people better. And then the second job is to improve job 1. I think most physicians, especially physicians that I coach, most people really love job 1. Like they love taking care of patients. They love the hands-on interaction. They love touching individual lives. And I love that too, but I really have an extra passion or, ability in terms of job 2. Like I really love looking at, well, okay, this made it better for, this patient, but, we probably could make that even better for 10 patients, 100 patients, or we could make it work better for, the physicians to make it easier for them to do that job with that one patient. That sort of stuff I think is really exciting.
Yeah, so you brought that topic that I really want to talk about, that burning question that I have, is that you started realizing that this whole physician burnout rate was more than just, you looked at the rates and you wanted to do something about it. Again, you wanted to change the system. Can you tell us how you got involved in that?
Yeah, because
what did you do?
I mean, look at it. We know physicians, right? Like that's the group of people we trained with. We know that we're very resilient, right? So to have this very resilient group have very high levels of burnout, like it makes you wonder, like, well, what else is going on? And a couple years ago, that's when they published the data saying that, physicians as a group had the worst suicide rate of any profession. And I have a very distinct memory of sitting at my office, doing my due diligence, reading all the updated studies, reading that, and then moving, to my other part of my desk to start doing some, charting on patients, and then stopping because I had read something that was supposed to be shocking information. The physicians having the worst suicide rate was supposed to be like, shocking information. And my first reaction was, oh, well, that makes sense to me. And the fact that it made sense to me was horrifying.
That's
It shouldn't
horrible.
make sense. It
Yes.
should be terrible. We should be
Right.
leaders in wellness, but we're not.
Right. So, I mean, yeah, we're the experts in our field. We're not supposed to be the ones who are the patients. We're supposed to be taking care of patients, right? We're
Right.
not supposed to reveal that. So, what exactly bothered you about the system, and what did you change?
Yeah. So I thought about, the patients that I had, which included, physicians. I've taken care of many physicians over the years, especially when you live in rural areas. You don't have many options. Physicians have to see somebody. It's going to be one of your colleagues. And I knew that anytime a physician came to see me and they had some sort of, mental health issue, anxiety, depression, whatever it had to be, the from time that they saw me the first time to time to actually doing something and acknowledging the problem, and whether it was medicine or therapy or just, changing their work life to make things better, like that was usually at least a good 6-month process. It took a really long time to get physicians to accept help.
Wow.
And part of that was they knew that every year when it came time to renew their license, they were going to have to disclose, right? So if in our state, if you had any mental health diagnosis, any mental health treatment whatsoever, you had to write, you had to acknowledge that that had happened. And then you needed a letter from your treating physician proving that you were safe to practice.
Every single year, no matter when it happened.
Which, as you might imagine, was a pretty big barrier. I mean, that's what they were telling me. So then that sort of led me to the next step. Well, those are my anecdotes, right? Like physicians don't want to make decisions based on just, case studies, right? You got to have some big data. But the data was there and supported it. That was a known barrier to physicians getting mental health treatment. And so I said, okay, well, the anecdotes match the data. We know that that's a barrier. We know that that barrier exists. Like, fix the barrier. Take it down.
Yeah. So then what did you do? How did you fix that?
So, I mean, I was a little naive at the beginning. My first thought was, well, I'll just call the board. I'll just explain to them all of this data and then we'll just fix it, right?
That's all it takes. So step
That's all
forward.
it takes. You just need to know. But, it actually is a fairly long involved process, because it wasn't just them deciding the rule. They had to ask that because there was an administrative rule that existed that required that. So we had to sort of do this very official process to change the administrative rule. But in order to do that, you have to, get some more friends, right? You have to sort of build a coalition of people. So it's not just one doctor who takes care of physicians sometimes saying, I think we need to change the rule, but it's, you going to our South Dakota, State Medical Association, or SDSMA, talking to the policy counselors, getting them to sign off and agree. It's going to my health system and saying, hey, I think we need to change this. And they say, yes, we agree. It's going to our competitors and asking them, what do they think? And they say, yes, we agree. It's getting everybody together to sit down and say, okay, well, everybody agrees. How are we going to change it?
Wow. And then you changed it.
And then we did.
Wow. That's amazing. So who does that affect? All the physicians?
So it's everyone that in South Dakota that is sort of regulated by the South Dakota Board of Medicine. So it is physicians, but it's also, like respiratory therapists, physical therapists, anybody who's sort of overseen by that group, that change affects all of them.
Right. And so what has happened since then? Is it transparent to physicians that this has happened? And when did it happen?
So it's official May 5th. So it's official now.
Congratulations.
Yay. And physicians I talk about this a lot because I think that, we suffer a bit from secrecy. The idea that we can't talk about these things. We can't talk about mental health issues. We can't talk about burnout. We can't talk about anything that isn't, patient focused. But, a good functioning health system isn't just making sure that, the patients are well taken care of. It's also making sure that, it's a sustainable system for everybody who works in it. Yep. So, what I started telling them was like, yeah, hey, the rule is effective now. I mean, people are relieved. I mean, physicians are, I've had people thank me, say, thank you. I feel so much better. Now I can, finally feel a little bit more at ease about what I'm doing. I've had people, COVID, there's, even for people who don't inherently, have anxiety or depression or other sorts of issues, COVID has sort of raised the bar in terms of this additional level of stress. Absolutely. And to know that, well, if I get to the point where I'm so stressed out, I need to, see a therapist or do something about it. I don't have to worry that now I have to report it and I've got this whole other level of stress. Gosh. Like people feel relieved, even if they never need it.
Yeah. So Clarissa, how do we get that in our states? Can you come to New Jersey?
So I'm working on it. Actually, I've got
really?
all of the stuff that I used, and then I'm sort of putting it all together. And eventually, I'm going to put it on my website so that people have access to it.
Oh, that's fantastic! And we'll get that information at the end. So before we finish this conversation, which is this is amazing. And kudos to you. You started with a phone call, you built your coalition, you made a change. That's tremendous. And now you're going to change the whole country. I see it.
Little by little.
So you wrote this fantastic article. I think it was on kevinmd.com. It was The War on Two Fronts. It's a phenomenal article. Could you just summarize a little bit for everybody what that article is about and how?
Sure. So, I mean, I'm a frontline physician too. I mean, I work as a hospitalist. I worked in the COVID unit, one of the first positions in our COVID unit when it first hit South Dakota, and then several times since then. And I knew going into it, like, it was going to be stressful, right? We have all these new things to learn. We don't know exactly what to do with COVID patients in terms of therapies. We're going to have all this extra gear. You know, I'm going to have to, like, I chose to self-isolate, like I was staying in the guest room. And so there was all these other sorts of stressors. And I knew all those things going in, and I was prepared, well, as much as you can be.
Right.
But then it's like, you know, you go through these days, these hard days where you're seeing these people who are sick, and you're like, you hope you're helping them, but then people still, you know, weren't doing very well, and some of them would die. And then you would come home and you'd say, okay, well, now I'm going to, you know, have some reprieve. I'm going to, like, decompress a little bit. So you do things like, well, I'm going to, you know, go on the internet, or I'm going to do social media. And then you would see people saying things like, well, COVID isn't even real. Or, you know, those doctors, they're just falsifying you know, those death certificates to say that it was COVID when it really wasn't. And there's really nothing to worry about. Or those people, you know, those physicians are lying. And you're like, you know, I'm spending all this time and making these sacrifices, which I'm doing gladly, and everybody else is, you know, I'm not unique in that. Physicians will do that. But to have that sort of like secret, you know, side gut punch where you're like, oh,
yeah, a punch from both sides.
There's a group of people that, you know, think that what I'm doing isn't meaningful and doesn't matter. And now I've got to sit here spending some of my time trying to explain to them, well, no, actually, that's not true. Like, that's the second front of COVID. That's the part that I didn't see coming. And the more, you know, the article sort of brought out like lots of conversations, and the more I talked about it, the more I got, you know, a lot of physicians saying, yeah, me too. Like, I know exactly what that feels like.
Right. Yeah. Meanwhile, you're dealing with deaths like never before, and the trauma I can't even imagine as a frontline worker. Thank you so much for your services, Clarissa. And I hope your whole family's safe. So how can people reach out to you, Clarissa, for information? You know, we all need that in all of our states, even more now than ever before. We need physicians to have access to wellness programs and feel comfortable going to them. Where can they find out even information? Because I'm sure that there's more conversations we can have beyond this about how do we even deliver wellness, you know?
Yes.
So how do they find you, first of all?
So I am available on LinkedIn. I think that's a good way to sort of just reach out, you know, Clarissa Barnes, MD. And then I've got a website that I'm launching later this month. That'll be drclarissab.com, which will also have some of this information on it.
Excellent. And as a last question, what's the best wellness program that we can provide for our clinicians? What does that encompass?
So I think a truly functioning wellness program is multi-leveled. I think, you know, it's easier to do the sort of, you know, individual physician level things, the coaching, which obviously I love. I'm a certified coach. I think coaching is fantastic, you know, or referrals to, you know, psychiatrists or therapists to actually deal with mental health issues. But I think a truly functioning wellness program also goes beyond that and says, okay, how do we make this job work better? How do we make it so that we don't get to this point in the first place? Is there institutional systems that we need to change? Are there, you know, electronic medical record things that we need to make more efficient so they're not spending 2 hours every night charting, and they could only, you know, when they could do it in 10 minutes. And then it's, you know, the system being an advocate saying, okay, well, I as a health system can't change the mental health disclosures at the board level, but I support you when you advocate that. I have your back, and I agree that that's something that needs to be different for your well-being. Again,
a guiding coalition.
That's right.
Of different leaders coming together to make it happen. Excellent. Thank you so much, Clarissa. So nice talking to you. You stay safe, and hope to have you back next year when we hear the results from all the work that you've done.
Absolutely. Thank you so much.
Okay, take care.